The Navy SEAL woke up screaming. Not from pain. From memory. At exactly 8:19 p.m., St. Ridge emergency room shattered into chaos. The gurney burst through the doors, wheels slick with blood. Monitors screamed. Paramedics shouted. Doctors rushed in, confident they were in control. They were wrong. The man on the stretcher wasn't seeing the He wasn't seeing lights or masks or gloved hands. He was back somewhere else, dark, loud, unfinished. When the first doctor touched him, the SEAL exploded. Ripping off lines, swinging with trained precision, eyes wild with danger. Security froze. Doctors backed away. Someone whispered, combat trauma. That should have been the end of it. Then a rookie nurse stepped forward. Small, quiet, forgettable. She leaned close and whispered 6 soft syllables. The SEAL went completely still. And in that frozen second, the entire made a fatal mistake. They assumed they were in charge. They had no idea who she really was. St. Ridge was built for emergencies, but not for moments like this. Not for the kind of silence that comes right before something breaks. The Navy SEAL lay strapped to the gurney, chest rising too fast, pupils blown wide. Blood soaked through the shredded tactical shirt. A faded trident patch still hung on by a single thread. GSW shoulder, possible internal bleed, BP unstable, a paramedic rattled off. Doctors swarmed in, orders flew. Trauma bay now. Prep for sedation. Get restraints. That was when the SEAL's eyes snapped open. Not groggy, not confused. Alert, too alert. Don't touch me, he roared, ripping the oxygen mask off his face. The sound wasn't human panic, it was command-level fury. A monitor crashed, an IV pole clattered. Security rushed forward, hands hovering near tasers. Stand back, someone shouted. The SEAL kicked, twisting with terrifying precision despite his injuries, every movement trained, efficient, dangerous. He's combative, a doctor hissed, PTSD, call psych. They circled him, confident and afraid. They didn't notice the nurse near the supply cart. Lena Ward, rookie badge, plain scrubs, hair tied back tight. She'd been on shift barely 3 months. The interns called her, the quiet one. The kind who volunteered for night shifts and never corrected anyone. The kind who got overlooked. Ward, stay back, a resident snapped. This isn't your case. Lena didn't answer. She was watching the SEAL's breathing. Fast, shallow, left shoulder guarding. Eyes tracking exits. Not fear, assessment. The SEAL jerked as a doctor stepped closer. Restrain him. No. The SEAL shouted, don't grab me. For a split second, the saw it. Not aggression, terror. Then Lena moved. Not fast, not dramatic, just 1 step forward. Ward, someone barked. Get out of there. She ignored them. She stopped at the side of the gurney, close enough to see the fine tremor running through his jaw, close enough to hear his breath hitch like he was fighting something only he could see. She leaned in, and whispered 6 quiet syllables. No one else understood them. They weren't English. Not medical. But the effect was instant. The SEAL froze. His fists unclenched. The rage drained from his face. Slowly, carefully, he lowered himself back onto the mattress. The monitors steadied. The room forgot how to breathe. The SEAL's eyes locked onto Lena's. Recognition, disbelief, relief. Ma'am, he whispered, voice shaking, is that really you? A murmur rippled through the Sir, lie back, a doctor said sharply. You're disoriented. The SEAL didn't look away from Lena. You're alive, he said. They said you didn't make it. Lena swallowed. Her hands were steady, but her pulse wasn't. You're bleeding, she said softly. Focus on that. He grabbed her wrist, not violently, not desperately, gratefully. You saved us, he said, all of us. Every head in the room turned. What is going on? Someone whispered. Security slowly lowered their weapons. Dr. Reeves scoffed. Enough. Nurse, step aside. You're encouraging a delusion. The SEAL turned to Reeves. You touch me, he said quietly, before she clears it, and I will walk out of here bleeding. No one doubted him. Reeves hesitated. Lena gently freed her wrist. Let me see the wound, she said. It wasn't a request. She peeled back the blood-soaked gauze. One look, and something dark flickered behind her eyes. Recognition. The entry angle. The fragmentation pattern. She knew this injury, not from textbooks. Her breath slipped out before she could stop it. No, not again. The SEAL heard her. Eyes widened. You remember, he said. She didn't answer. Memory was already dragging her somewhere she didn't want to go. Sand. Smoke. A radio screaming for help that never came. Vitals dropping, a resident shouted. The SEAL arched in pain, gasping. Alarms screamed. The surged back into motion. Pressures crashing. Prep for emergency surgery. Reeves snapped orders, desperate to reclaim authority. We're opening the shoulder artery. He'll lose the arm if we don't act now. Every eye turned to Lena. She stared at the wound, at the angle, at the truth no one else saw yet. The SEAL grabbed her hand again, weaker this time. Please, he whispered, don't let them take my arm. Lena looked down, at a man who trusted her more than anyone else in the room. And quietly said, if you do that, you'll kill him. The room went dead silent. Reeves stared. Excuse me? Lena didn't raise her voice, didn't explain, didn't defend herself, she just repeated it. You open that artery, she said, and he dies. The monitors screamed louder. Time was running out. And the had to decide. Ignore the quiet rookie nurse, or trust the one person the SEAL believed could save him. The was alive with motion again, but the energy had changed. Doctors and residents moved faster now, but uncertainty weighed heavier than the blood on the floor. The SEAL's vitals were unstable. His breathing shallow, his BP flickering dangerously. Every beep from the monitors sounded like a countdown. Code trauma, right side, a resident shouted. Lena moved to the side of the gurney. Calm, focused, her hands steady despite the chaos. She didn't speak to the doctors, she didn't argue, she simply assessed. The SEAL flinched at every touch from anyone else. His eyes, wide and haunted, tracked everyone but her. She won't survive if we let him crash again, one resident whispered. Another muttered, glancing at Lena, isn't she the rookie? They all had underestimated her. Again, the SEAL's oxygen saturation dropped, his pulse faltered. Alarms shrieked. Dr. Reeves barked orders, but his voice lost authority in the room. Everyone hesitated when Lena spoke. Secondary blast trauma, she said softly, almost to herself. Not primary cardiac. Fluid shift compressing the right lung. He's drowning internally. Heads snapped toward her. What? Reeves shouted. Listen, Lena said, calm but urgent. Shock now, you fry the wiring. Pressure stays. We decompress, give him a chance. A resident stepped forward, unsure but trusting. Lena handed over the needle like it was an extension of her own arm. The attending tried to stop her. You can't. She didn't answer. She aligned the needle, cleaned the site, and inserted it with the fluid precision of someone who had no second chance. For a breathless moment, nothing happened. Then the monitor line trembled, flattened, slowly climbed. The SEAL drew a deep, shuddering breath. His color improved slightly. Lena didn't pause. She adjusted IV fluids, titrated oxygen, monitored rhythm, all without a single hesitation. The had become her battlefield. Every movement from every doctor, nurse, and intern now revolved around her. Not because she outranked them, because the SEAL trusted her, and that was enough. Minutes passed, each heavier than the last. The SEAL's vitals climbed from catastrophic, to dangerous, to fragile stability. Alarms softened, the chaos quieted. He was still in danger, but for the first time, there was a thread of hope. He looked at Lena, weakly, but with intent. Doc. Ward, he rasped. The name hung in the air. The attending's mouth opened. Ward? Lena's hands didn't stop moving. Stabilizing, she said softly. You call that stabilizing? Reeves barked. You'll kill him if you open the artery, she repeated. Pressure first. Hemodynamics, then intervention. Reeves faltered. The arrogance that usually filled the room had nothing to stand on. The SEAL tried to lift his head, wincing. You saved us before, he whispered. You'll save us again, right? Lena nodded once. No pride, no hesitation, just quiet certainty. The resident who had handed her the needle earlier glanced at the others. She knows what she's doing, he admitted. Lena's eyes never left the SEAL's. The room adjusted around her. Every movement became purposeful. Every instruction calculated. She gave commands as if on the field. not to assert authority, but to save a life. Minutes felt like hours. The SEAL's breathing evened, his eyes softened, haunted but attentive. Lena leaned closer. You're holding on. Don't let the memories drag you down, not here, not tonight. He whispered, voice rough, I can't let anyone else touch me. She didn't flinch, then they won't. And suddenly, even Reeves understood. This wasn't a rookie nurse. This was someone who had lived through the exact terror he couldn't imagine. Someone who had survived it. Someone who could save him again. The alarms quieted further. Machines beeped in rhythm. Stability wasn't perfect, but it was enough. Enough to know the SEAL would survive the next critical minutes. And just as Lena allowed herself a breath, a subtle tremor ran through the SEAL's hand. Not pain, not weakness. Memory. Something in him remembered everything. The night, the ambush, the fire, the loss. His eyes found Lena again. You were there? She nodded, just slightly. I've been here, she said, voice low, watching, helping, keeping you alive. The room grew still, not out of fear this time. Out of realization. The quiet nurse they overlooked had carried a secret the entire time. And now, the full weight of it was about to surface. The held its breath. The SEAL's pulse steadied, but his eyes were glassy with memory. Lena didn't speak, she didn't need to. Every movement, every calm adjustment of IV lines, every gentle press on his wound, was proof enough. A young resident whispered, almost to herself, she's not just a nurse. Lena leaned close. Her voice, quiet but commanding, cut through the tension. Hold pressure. Watch the rise. Don't let him twist. The SEAL flinched at nothing. His body recognized the precision. Muscle memory kicking in. Training. Trust. In that instant, the room blurred. Lena's mind drifted backward, just for a heartbeat. Flashback. Night in Mosul. Rubble everywhere. Gunfire in the distance, too close. A teammate screaming, trapped under debris. Blood pooling. Darkness pressing in. And there she was, kneeling in the dirt, hands steady, reading wounds by instinct, not instruction. They called her Doc Ward back then. No one else. Just her and the injured. And the SEAL, pinned behind a shattered wall, covering her as mortars fell overhead. Flashback ends. The SEAL's breathing caught her back to the present. He needed her now, and she responded instantly. Secondary blast trauma, she repeated softly. Fluid shift. Tension building. The attending hovered, wanting to take control. Lena turned, calm, deadly precise. Step back. Now, you'll kill him if you intervene wrong. His jaw dropped. Everyone froze. She moved to his side, hands flying over the gurney, each motion trained, exact. Needle inserted. Pressure relieved. Oxygen adjusted. Fluid lines calibrated. The SEAL's vitals climbed steadily. Each breath he took whispered trust. The room watched. Shock, awe, confusion. Then she spoke again, and this time the SEAL's voice rose in recognition. You never left, you stayed with us. Her fingers pressed gently to his chest. I'm here, I never left. Dr. Reeves, finally understanding, whispered, how? Lena shook her head. She didn't answer. Action spoke louder than words. A sudden alert, BP dropping. The SEAL groaned, pain flashing across his face. She didn't flinch. Muscle memory kicked in. Listen. Tilt the head. Pressure on the wound. Stabilize the fluid. Watch oxygen. Her voice, soft but firm, guided everyone. For the first time, the followed her, not Reeves. The SEAL arched, trying to sit up. Pain and panic fighting. Stay down, Lena murmured. I've got you. Every movement from her screamed training. Not from a classroom. Not from textbooks. From blood and fire and loss and survival. Flashback. A field medic in Iraq. 6 teammates pinned under fire. No backup. No evacuation. She moved between them, patching, stitching, holding breaths, holding them alive, holding herself together. Every decision had been a gamble. Every second, a choice between life and death. Flashback ends. Back in St. Ridge. The SEAL's breathing eased. Lines stabilized. Alarms softened. He lifted a trembling hand. Doc? Ward, he whispered. Her gaze met his. Alive, she said softly. Both of us. The room leaned in, realizing the truth. She hadn't just been a nurse. She had been their ghost medic. the one no one expected. The SEAL's hand shook as he reached for hers. You saved us all that night, he rasped. She let him, gentle, not victorious, not proud, just present. No, she said. I only kept you from dying that night. The rest? He shook his head. You carried us through hell, all of us. The monitors beeped steadily now. The chaos of the had quieted. Every doctor, every resident, every nurse paused in stunned respect. It wasn't just her skill. It was the weight of the lives she had carried silently for years. Then came the final test. Sudden alert. The SEAL's vitals dropped sharply. The attending moved to intervene. Lena's hand shot up. Stop. Don't touch. Watch me. She adjusted lines, decompressed, repositioned oxygen, kept him alive. Every motion precise, practiced, lethal in its efficiency. Within minutes, the crisis passed. The SEAL looked at her, eyes shining. I never forgot you. Lena exhaled, quiet but hard won. And I never forgot you. That's why I stayed alive. The had witnessed something it had never seen before. Not a hero in uniform, not a decorated soldier. A nurse, quiet, overlooked, extraordinary. She had revealed herself, not with words, not with titles, but with action. The SEAL's hand gripped hers once more. You saved me again. She nodded, and I'll do it again if I have to, but this time, no one dies unnoticed. The room was silent, reverent, odd. Lena Ward was no longer invisible. Not in this not to the SEAL, not to anyone who would doubt her again. The was quiet, not the quiet of emptiness, but the quiet of awe. The monitors beeped steady. The chaos had passed. The SEAL lay back, chest rising evenly, eyes soft, still locked on Lena. He reached for her hand again, not a command, not a plea. Recognition. You stayed, he whispered. I did, Lena replied, calm, controlled. The attending, Reeves, finally spoke. Ward, He faltered. Words failed. All the arrogance, all the ego, dissolved. Outside the trauma bay, residents whispered to one another. She's not just a nurse. She's impossible. Lena let them talk. She didn't need their approval. The SEAL tried to sit up, weakly, carefully, and with her support, he managed. I owe you everything, he said. Everything I am, everyone who survived, it's because of you. Lena shook her head gently. You all did the hard work. I just made sure someone came home to tell the story. He smiled faintly, pain still shadowing his face. Then let me tell you this. No one sees heroes like you enough. But I do, and they should. She allowed herself a small nod. Not pride, not satisfaction, just acknowledgement. A knock at the door. The military liaison stepped back in, calm, precise, professional. Captain Sharp is stable. Your presence is requested for a debrief. Lena's pulse quickened, but she remained composed. Eli's gaze met hers. Silent understanding passed between them. She wasn't leaving him, not yet. Not until he was safe. Outside the room, the staff gathered. Some hung back, some peeked through glass. And slowly, they began to understand. This quiet, overlooked nurse, the one they dismissed as inexperienced, soft-spoken, insignificant, was the reason their patient lived. The reason a SEAL survived. The reason a ghost medic had not only returned, but dominated the room with skill, calm, and authority. Reeves cleared his throat, voice small now. Ward. We judged you without knowing your war. I apologize. She didn't answer immediately, she simply smiled faintly. Never judge, she said. Never assume silence is weakness. And never forget, those who carry the quiet burdens are often the ones who keep everyone else alive. The words lingered. A lesson heavier than any code or protocol. Eli reached for her hand one final time. Doc Ward. Thank you, he said. Her lips pressed into a thin line. I just did my job. But the room knew better. She had done more than her job. She had saved lives, reclaimed respect, and reminded everyone that true heroes are not always the loudest, the boldest, or the most decorated. Sometimes they are the ones who whisper 6 syllables no one else recognizes. Sometimes they are the ones standing quietly in the background, until the world erupts around them. And when it does, they are the calm in the storm. The SEAL closed his eyes. Relief, gratitude, respect. Lena stepped back into the hallway. Heads turned. Conversations stopped. Eyes followed. She wasn't a rookie, she wasn't invisible. She was Lena Ward, RN, Doc, Ghost Medic, Survivor, Hero. And for the first time in a long time, she let herself believe it. The hospital moved on, patients treated, alarms silenced. But the lesson remained. Quiet heroes exist. Invisible heroes endure. And when they act, even the world stops to watch. She paused at the threshold. Never asking for recognition, never seeking applause. Just standing there. Present, seen, finally allowed to be. The SEAL's voice, faint but clear, reached her. "You saved us," he said. She nodded once. "And you, keep doing it," she replied. A final pause. The story, and the silence, lingered. The world outside the continued, but inside, one quiet nurse had forever changed how they would see heroes.